about pneumonia. So when we talk about pneumonia, this is just like asthma. It's an inflammatory disease, an infection that is of inflammatory nature, and it inflames the alveoli. That is the air sacs. Can affect one lung or both of the lungs. So we look at its pathophysiology later on, how it involves from the point of an invading pathogen getting into the lungs to the point where there is an immune response. So I don't want to talk about the anatomy physiology, the classification maybe briefly, but we want to focus on the pathophysiology. So pneumonia, inflammatory disease, that's inflammation of the, and this inflammation can be brought about by various microorganisms. We have the bacteria, the mycobacteria, the fungi, the viruses that get into the lung. And from the morning when we talked about inflammation, of course, that means that there an inflammatory response causes inflammation in the lung parenchyma, that's in the alveoli. And the end result is that gases exchange is going to be affected. That will be seen in the clinical manifestations that we'll be looking at later on. I don't talk about the anatomy physiology. That's something that you have knowledge about. Classification of pneumonia according to that's the anatomical classification. The lobar pneumonia, which affects all or large segments of one lobe, or more of the pulmonary lobes being involved, and what you know what the lobes are. The bronchopneumonia, where the terminal bronchioles will be clogged with mucopurulent exudates, which are end products of that inflammatory reaction, can still be referred to as the lobar pneumonia. Types of pneumonia: community acquired, which happens within a community setup, usually affects the young people, can be caused by various agents like the Streptococcus pneumoniae, the H. influenzae. All those are those agents that can bring about community acquired pneumonia, which can happen within a community setup. We have the hospital acquired pneumonia or the nosocomial pneumonia, which happens within a hospital setup, where now the symptoms can happen 48 hours after one has been admitted. And mostly some of those causative microorganisms like the Pseudomonas aeruginosa, the Klebsiella pneumoniae, which can invade now after one has been admitted to the hospital. And this presents itself mostly 48 hours after, more than 48 hours after one has been admitted. We have pneumonia in the immunocompromised host. Usually those people with whose immune system has been compromised. Mostly this can happen in those patients with the tuberculosis. Then we have the healthcare associated pneumonia, which happens with those patients who have had a recent or contact with healthcare facilities, like those who have been to dialysis centers, those who have been nursing homes or outpatient clinics. We have the aspiration pneumonia, when one accidentally inhales food, a drink, or vomit or saliva from the mouth now into the lungs. Of course, now once they inhale that, the good recipe now for developing pneumonia. So some of those, the ventilator-associated pneumonia, more especially those patients on mechanical ventilation. You can see here, mechanical difficulties in breathing, and they have to be put on ventilators to assist them with their breathing. So in the process of that, of course, when they are using mechanical ventilators, that now creates a good harbor now for organisms to get their way into the lungs, because now they are not breathing on their own, so they can they don't have the gag reflex, the cough reflex, they're not able to expel out. They get their way into the lungs, and thus leads or causes now the body's immune system to respond, and that leads to pneumonia. So it's a very common condition. Usually affects those with a weak immune system. See, is the HAP, the hospital acquired pneumonia, which account for about 15% of the cases of infections we get to see in those patients with pneumonia. So pneumonia can be caused by causative agents, bacteria, infections, which can be also associated with pneumonia. Exposure to some chemicals, chemical irritants, which can also get their way into the lungs. Recent surgery, like those who have undergone any form of lung procedures or trauma to the lungs, and also can be seen in infants and very young children. Again, goes back to the point of the immunity is still not that strong to fight off these pathogens. Those who engage in alcohol and drug abuse, and also hospitalization in the intensive care unit. Those in the intensive care unit who most sometimes develop the uh, the ventilator acquired pneumonia because they are on mechanical ventilation. So what happens with now pneumonia from the point of the pathogen getting into uh, the respiratory tract to the point when it's going to present itself in form of the clinical manifestation. So of course, we have to start from the point of entry, infection now getting into the respiratory tract. Once it gets into the respiratory tract, irritants from that infectious agent will be inhaled, and thus they will be able to reach the lungs, um, either by droplets or by aspiration of the organisms from the upper airway, or just through the bloodstream. So they'll find their way uh, into the lungs. And some of those common organisms you have just mentioned them, the causative or the etiology, the causative background, the various bacteria we have just talked about, the viruses, the fungi that can cause pneumonia. We know from when we talked about inflammation in the morning, once these irritants now get into the lungs, then the immune system, of course, is going to activate an inflammatory response just to in response to these microorganisms. Are we following, guys?
Yes,
Are we following?
yes, you are following.
Yes, we are following.
Thank you. Yeah, somebody. Oh, sorry. It's like people are not hearing me clearly, but now they have said they hear me. I'll be sharing the notes. Worry not. If you are losing me, please just drop a message in the chat box and I'll be able to see that. So once the irritants now get to the lungs, immune response will be activated. Um, so inflammatory reaction will occur. The cytokines will be released, and once they are released, they'll attract the neutrophils, they'll attract the rest of the immune cells, because once they have been released, now they initiate an immune uh, response. With now immune response being initiated, inflammation, of course, is going to uh, occur, because now there'll be an influx of the immune cells which are going to cause inflammation of the alveoli, and also the interstitial tissues. The alveolar capillary membranes will become more permeable. That's allowing fluid, proteins, and the immune cells now to enter the alveoli. And once now they get in, of course, now they'll interrupt the transportation of oxygen. They want to impair gaseous exchange, because now there's accumulation of the exudate in the alveoli. Because now, once the cytokines have been released, they are going to cause fluids to leak into the alveoli. And once they leak into the alveoli, there will be exudate that is going to accumulate in the alveoli. And that exudate, of course, is going to impair gaseous exchange. That means that now the lungs will not be able to oxygenate blood that is coming in from the heart for oxygenation before now it can be pumped to the rest of the body. So that means now one is going to present now with the clinical symptoms now of impaired gaseous exchange. So you will see symptoms like dyspnea, where now there is now difficulties in breathing. You will see now patient presenting with the cough, because now cough comes in as a reflex, trying to open up the alveoli to allow oxygenation to take place. Chest pains, sputum production, because now with the exudate formation, there will be increased sputum production. If you use your stethoscope to auscultate the lungs, you'll now hear crackles, you'll hear decreased breath sounds, and also if you do percussion over the lungs, you'll hear that there is dullness once you do percussion. I'm sure that you understand what percussion is. So once you you percuss over the lungs, you will feel that there is bit of dullness, which is as a result now of the accumulation of those fluids and also the exudate in the lungs. So that's going to result in hypoxemia. There'll be decreased supply of oxygen to the rest of the body, because there's decreased or impaired gaseous exchange. Difficulties in breathing will happen there. And if this is not managed, potentially can lead to lung failure, which can lead to death. But with effective treatment, inflammation is going to resolve, lung function is going to return to its normalcy. But if it's not left treated, then of course complications will come in, abscess formation from that exudate, pleural effusion will come in, sepsis can come in, and eventually death. So the signs and symptoms which I've just talked about: fever, chest pain, increasing pulse, because now the, the heart itself is receiving less of the oxygenated blood. So it will try to increase its beats, just to make sure that it's pushing more blood to it, to the lungs for oxygenation, so that it can be supplied to the rest of the body. Tachypnea, pallor, and sputum are some of those symptoms that can be associated with pneumonia. Hemoptysis, where one can easily now cough out blood, chest pains, shortness of blood, shortness of breath will come in, fatigue. That's muscular symptoms. There'll be fatigue, there'll be muscle aches, because one is trying to labor. Low blood pressure, because now less blood is getting oxygenated, so the heart is also receiving less blood. High heart rate, because now the heart will try to increase its heart rate, just trying to pump more blood to the lungs to increase gases exchange, or to be oxygenated to supply to the rest of the body. So if you want to assess for patient with pneumonia, I'm sure this will come much later, but then of course, from your history taking, you'll be able to see these signs and symptoms. Physical examination, if you auscultate, you'll be able to hear the dullness, the decreased breath sounds, the percussion. If you do percuss, you'll hear the dullness over the lungs. If you do chest x-ray, you'll see multiple infiltrates, which is a sign of now the accumulation of fluids within the alveoli. Any question? The arterial blood gas. If you do the arterial blood gas usually measures the level of oxygenation within the body. That's the arterial blood gas. So that will show you that there is decreased oxygenation in the body. It basically checks on the pH of the blood, checks on the partial carbon dioxide, partial oxygenation, bicarbonate levels, and the oxygen saturation. You'll see that all those components will be affected because there is decreased gaseous exchange. Pulmonary function tests, which will show that there will be decreased pulmonary function because of the accumulated fluids within the alveolar. Electrolytes will also be affected, they'll be low because of the decreased gaseous exchange. Any question on that?